How do you know? Starts in your shoulder and it ends down here past your elbow. When that muscle, when you bend your elbow, that muscle shortens. When you extend your elbow, that muscle gets long. It only gets short and only gets long. When you cut that tendon, tear that tendon, that muscle goes back to where it originated from. That's just how muscles work. That's how tendons work. So if you have a full tear, I usually tell all my if you have a full tear, you need to have surgery, right? Because it's fully torn. How any of you here have a full tear? How do you know? Well, we do what's called clinical testing, right? So when you can raise your arm up and slowly bring it down by yourself, you most likely don't have a full tear, right? If you can bring your arm out like this, um, you most likely don't have a full tear, right? How you for sure see it is through MRIs. MRIs allow us to look at soft tissue. MRIs are usually used to have surgery and to make sure you're in a position to go into surgery and stuff like that. X-rays only see bone. It sees the shape of the bone, it sees the position of the bone. So when you're taking X-rays, all they're looking for is, do you have arthritis? How bad is your arthritis? And where does your bone sit? So it should be sitting where it's sitting if you didn't fall, right? If you fell and dislocated it, then your shoulder might sit down here or might sit back there, and you'll see it on an x-ray. But you'll see it in person too. Like you can tell it clinically before you see it in x-ray, but x-rays can show you a little bit more in depth, right? MRI is like a picture. So I would say if you have this nagging shoulder pain and you still have it months down the road, x-ray is not going to show you anything. X-ray is like a picture. It's like a picture. MRI is like a picture. It's just developed in a different way. Clinical evaluation and testing to rule in and rule out stuff, which is what we do in a therapy setting to find your problem, is like watching a movie. We want to look at how much motion you have, but it's not just about how much motion you have. It's looking for the quality of movement that you're supposed to have as compared to other parts. So I can see it when someone moves, how they are moving in terms of quality of movement. Does that make sense?